On average, pregnancy rate per one cycle of IVF is usually 30 to 40%, and I will introduce several methods to improve pregnancy rate in our Maria Fertility Hospital. To increase pregnancy rate, we have to produce many oocytes, many eggs, and we can improve fertilization method, and we have to select good embryos for transfer, and we can use several embryo transfer techniques. So to produce many eggs, controlled ovarian hyperstimulation is done, and there are several fertilization methods. Conventional method is natural fertilization and ICSI, but we can use IMSI and PICSI in our center, and I will explain you about it later. Selection of good embryos. We can use Embryo Scope, and for embryo transfer to assist embryos to implant, we can do laser assisted hatching. This IMSI, PICSI, and Embryo Scope is a new technique which can be done in Maria Fertility Hospital. So, to produce many eggs, we can use several protocols. Long protocol and Antagonist protocol is the most commonly used protocols, and we can use Ultrashort Antagonist protocol for poor responders, which means who has poor ovarian function. With long protocol, preparation injection, GnRH agonist is started before the start of period about 1 week ago. This preparation injection helps to produce many eggs, and from the third day of the period, gonadotropin, the main stimulation injection, is started every day. So when the follicle grows enough, then we are doing ovum pickup. With Antagonist protocol, we don't use preparation injection. On the third day, we just start gonadotropin, the main stimulation injection, every day. And when the follicle grows large enough, GnRH antagonist is started. This injection is for prevention of premature rupture of follicles. Ultrashort antagonist protocol. We use agonist from the second to fourth day of the period. This short period of GnRH agonist can stimulate the response. So we can produce many eggs with this preparation. Long period of preparation is not recommended in poor responders because in that case no follicles can grow, so we use only short period of preparation injection in this case. And on the third day, gonadotropin, the main stimulation injection, is started, and when the follicle grows enough, antagonist to prevent premature rupture is also started. Those protocols are usually used methods for every fertility centers, but I will explain you about IVM. This means in vitro maturation. Our Maria Fertility Hospital is a specialist for IVM, and this doesn't require any ovarian stimulation injection. On the 6th or 7th day of the period, ultrasound is done, and after checking the size of follicles, no gonadotropin, so less OHSS. OHSS is a severe syndrome which can be caused by many doses of ovarian stimulant injections. But with IVM, we don't use gonadotropin, so there could be no risk of OHSS. So after ultrasound, we can take the timing of ovarian oocyte retrieval. So that's why IVM is very comfortable for patients. They don't have to take everyday injection for ovarian stimulation. Mild stimulation. Sometimes we use only oral medication, Clomid, and gonadotropin. Sometimes we use only oral medication, and sometimes we can use a small dose of gonadotropin. And also Antagonist is used for prevention of premature rupture of follicles. And on ovum pickup day, we collect every eggs into the tubes, and these will be fertilized, and embryo will be cultured, and these cultured embryos will be inserted into the uterus. So the next step is fertilization. I will explain you about the method of fertilization. This is conventional method, just culturing the egg with sperms. Then this will be fertilized naturally. With ICSI, this is intracytoplasmic sperm injection. We select one sperm, we grab egg, and just insert sperm into the egg. That's ICSI procedure. It can be done in every center, every fertility center, so it is very common process of IVF. But we can do ICSI with only 400 times magnification. So sperms can be seen just like this. So among them, we have to select the best sperms. But there is a new technique called IMSI. With IMSI, we can magnify 6,600 times. So sperms can be seen like this. So we can see small vacuoles of the sperm. This small vacuole cannot be seen with a normal ICSI procedure. So with ICSI, we can select not the best sperms, but with IMSI, we can select the best ones with better magnification. And this is another fertilization method. This is called PICSI. You can see many sperms moving around, and this material is a material which covers egg, and you can see sperms which is bound to this material and moving, and some sperms just move around. These sperms cannot fertilize eggs. These are immature sperms. Only those that are bound to this material and moving are mature sperms. So we can use those sperms for fertilization. So with PICSI, we can improve our pregnancy rate. And for selection of good embryo, we can use Embryo Scope. This is the machine used in Embryo Scope. Usually embryo is cultured. Without Embryo Scope, embryo is cultured, and we can check it every day. So day 1, 2, 3, 5, we can check every day. So once a day, we can check the development of the embryos. But with Embryo Scope, embryos are cultured inside this box, and we can monitor them 24 hours. So we can check the whole developmental course of the embryos to select the best embryos. So we can see these videos recorded the developmental course of the embryos, and we can select them by checking the timing of division, when the blastocyst occurs. So we can check everything. And we can categorize them into these kind of embryos. Usually with conventional method, we only check morphology of the final embryos to select the best embryo. But with this Embryo Scope, although it seems good, it's also good, but this one has good morphology and good developmental course, so it's the best embryo. But for that, its morphology is good, but it had some abnormal developmental course. It's not a good embryo for transfer. But without embryo transfer, we cannot select this one. We may transfer this one because it looks like the best embryo. With laser-assisted hatching. So for implantation, this is embryo, and these thick, this translucent area is a kind of capsule around the embryo. So for implantation, it should be hatched. It should go out. But if this zone is thick, the embryos cannot hatch by itself. So sometimes we just make a hole with a laser to help its hatching. It's laser-assisted hatching. So hatched embryos can be transferred and they can be implanted. So to improve pregnancy rate, there are many methods which can be used, and our Maria Fertility Hospital seeks for the best pregnancy rate. So to improve our pregnancy rate, we apply the newest technique, and we will supply the best services for the patients. Thank you for listening.